Hello Baby live event. We are so excited to see you all here. Pregnancy is just the beginning of a life-changing journey of motherhood, and I hope to be able to spend just a little bit of today demystifying all of the unknowns and questions you may have during this first phase of life. I actually just had my second child, Max, 9 months ago. So I am very aware of what everyone's been going through and how scary pregnancy's been and how exciting it is to have a baby during this time. Our first session today is Ask an OB-GYN, and the OB-GYN in question is the amazing Dr. Kameelah Phillips, a board-certified obstetrician and gynecologist, wife, mother, lifelong women's health advocate, and today she's here to talk to us basically about everything, because I know all of you have just as many questions as I have, and we've been dying to ask her, and we haven't asked all these questions yet. So any question you haven't asked your OB yet, Dr. Kameelah Phillips is the woman for you. Please drop us any questions you may have in the chat and make sure it says for panelists and moderator, and we'll make sure to pick out a few questions for you. So with that, Dr. Kameelah, take it away.
Hi, everyone. It's so nice to meet you from the comfort of my car in Manhattan. Thank you for your flexibility, and it's great to meet you. I can't wait to answer your questions in the chat. That being said, let me introduce myself. I'm a mother of 3, just like some of you. My babies are not babies anymore, 7, 5, and my youngest is 3. I am a practicing OB-GYN in New York City, and I have some pearls for you, so let's get started. The first thing I wanted to talk about is your prenatal care. So listen, prenatal care is really important. And this is something that might sound surprising to many people, but it's actually important. People skip out on their visits because we're all still active working women. It's important to know that your prenatal visits are a time when you can get factual information from your doctor as opposed to those Google fingers that we often use. Please make sure that you don't skip out on your visits. Use this as a time to get evidence-based, tailored information from your doctor, because Google, especially when it comes to pregnancy-related concerns, is not always your best friend, okay? The second thing actually I wanted to leave you with during this time is the importance of protecting your mental health. The ups and downs of pregnancy and the postpartum period can be really profound. So I encourage you to protect your mental health during this time. If you have a history of depression, anxiety, obsessive compulsive disorder, then sometimes this can rear its ugly head, and we want to be there for you. In fact, sometimes these conditions can even worsen. Don't be ashamed of really any negative emotions that you may experience with pregnancy, because we've all been there. Call on your partner, your friends, and especially your OB-GYN to talk about your mental health, because in fact, mental health is extremely important. And we would even encourage you to start seeing your therapist again, get a new therapist. And even in pregnancy, mental health is so important that we start medications. Yes, we use mental health medications in pregnancy because your mental health is actually that important. We want to keep your mood on track. So as you're adjusting to the phases of pregnancy, postpartum, we can minimize the risk of postpartum depression and anxiety, which can really affect the bonding that goes on between you and your baby. Okay. So my third pearl for you would be to realize that you are mentally, physically, and emotionally stronger than you can ever imagine. But you have to prepare for labor. I instruct my patients to prepare for labor the way they've prepared for any other major event in their life. And this is both mentally, physically, and emotionally. You should train for labor, especially if you want an unmedicated labor. So what does that really mean? It means getting your body and keeping your body moving so that you can avoid unnecessary weight gain, and also to keep your heart strong, because pushing in labor is 100% cardiovascular, and it's important that you're ready for that. It also means connecting with your partner or a doula to help engage them on your plan for pain management. This means having a really concrete plan for how you're going to engage all of your senses for the intensity of labor. This is using light, touch, smell, sound, all of your senses to help you cope with the intensity of labor and the changing physical demands that you're about to experience. My fourth pearl is, just like training for labor, I encourage you to train for your baby. And this is typically in the form of education. We spend a lot of time and energy on classes, and everyone takes them because we're told to. But I think that there are 3 classes that are often overlooked for new moms that I would encourage you to take part in. The first class, breastfeeding. Now, I know you don't have a baby actively with you, but listen, a breastfeeding class can be invaluable. I recognize that you don't have a baby yet, but the anticipatory guidance and information and management of your expectations for your breastfeeding journey can be invaluable, especially late at night when you're running into trouble and you want to turn to Google. You can reflect on the information that you learned in your breastfeeding class to help get you through. Now, you have breasts, your baby knows how to suck, but you guys really need to learn how to be a breastfeeding team. And that's why I think preparing for breastfeeding with a breastfeeding course is really important. It also prepares you to have all the nipple care. Oh, can you guys hear me? Can you hear me still? Okay, great. It also helps you prepare for all the breast and nipple care that you can imagine, so you're not doing any late night runs for nipple cream. It introduces you to lactation consultants that you'll need, and these are the people that you'll find in this class at your pediatrician's office and also at the hospital. The next class that I encourage new parents to take is CPR. Now, you don't want to have to know this skill, but you'll be so glad that you have it if it's necessary for both newborns and especially when you start to introduce solids to your baby. The other class that I think that is often overlooked, or certainly you should engage an expert, is how to put in a car seat. I know it doesn't sound like a big deal, but safety, safety, safety. And I see babies go home all the time incorrectly in a car seat. So I would encourage you to do a car seat class. My fourth little pearl is in recognition that we are all headstrong, dynamic, and independent people. But look, this is a time when you need to let your village help you. Give yourself permission to let things go and let some of those days when you feel like you have boxes to unpack, clothes to fold, baby stuff to clean, let your village do that for you so you can take time to just take a nap and chill. If your friends and family offer to do things for you, please let them do it. Use this time to recharge, get your body back together. Now, be sure to set boundaries, especially with parents and people in your life who might be a little bit extra, but really this is a time, pregnancy, postpartum, where you need people to help you and surround you with love. If you just ran a marathon, you wouldn't go home and cook dinner. Same thing with having a baby. After you have your baby, don't expect that you have to do everything on your own. Let your village help you. The other thing that is often a concern with patients is the C-section. Now look, C-sections happen and most of the time they're unplanned. I really encourage patients who have a birth plan for a vaginal delivery, that's most of us, right? To understand if they have to have a C-section, why they had a C-section, the recovery, how it's going to be different, and how this C-section can affect their future childbearing. Your doctor can use really simple language to explain this to you, and it demystifies a lot of the C-section process. The other thing that's important is that you don't leave the hospital without adequate pain medications so that you're at home, that you've engaged your tribe, because you're really going to need their physical support, and prepare for constipation. Now, this is vaginal or C-section. Have your stool softeners at home and on board day one from leaving the hospital. My last little pearl, and then I welcome to open it up for questions, is get out of the house. Now, it might seem strange that I'm instructing you to get out of the house right after you've had a newborn, but really this is to protect your mental health and your physical health. Getting out of the house, getting some sun on your skin, the wind on your face can really help ward off the postpartum blues, baby blues, certainly postpartum depression, because you're out using your body and enjoying your environment, feeling like yourself again. So I recommend everyone by the end of week 1, make sure that you have a close girlfriend, mother, sister, whoever it is, come by your house to get you out of the house so that you can feel like a human being again, and not just a new mother. All right, I'd like to open it up for questions because I could go on and on about all the helpful tips that I think new moms can use, but this time is about you, so let's shoot.
Well, I think one of the biggest questions right now, Dr. Phillips, is do you recommend getting vaccinated for pregnant moms?
Yes, I absolutely do. So it's important for everyone to understand that the 3 big women's organizations, the fertility people, ASRM, these are the people who do IVF and help with fertility issues. ACOG, the Association for Obstetricians and Gynecologists, and SMFM, the high-risk doctors, all recommend that women get vaccinated for COVID, either before pregnancy, during pregnancy, and certainly postpartum. Regardless of the vaccine, where you are in gestation, we know that the risk of COVID far outweigh the risk of COVID vaccination. We see preterm labor, we see more severe disease, and often intubations. And so we encourage all lactating, pregnant, and postpartum women to get vaccinated. Absolutely.
And I think that was the other question is like, is it possible to pass on any of the antibodies if I do get vaccinated and I'm nursing?
Yeah. So what we have seen is that antibodies are present in the breast milk, which is amazing. We see this in other vaccines, for example, the whooping cough that women are offered after 28 weeks. The data is still out, but I'm sure it'll be positive that what we're missing, the piece that we're missing is whether babies benefit from these antibodies. Sorry, I live in New York. There's like a motorcycle club going by. What we're missing is whether or not babies will benefit from this antibody. That jury is still out, but regardless, we know we have antibodies in breast milk and we encourage vaccination.
I love that. There was a great question in the chat, which is, I'm 37 weeks pregnant and considered high risk. Are there things that I should know as I go into the delivery phase, I guess, of pregnancy?
Yes, ma'am. It's really important if you're high risk solely just because you're 37 or if there's any other issues. It is really important that you are aware of the signs of preeclampsia, headache that doesn't go away with Tylenol, visual changes, so blurry vision, double vision, spots in your vision, pain in the center of your chest or under the right breast. Those are signs of preeclampsia that you really should be aware of and communicate those signs with your doctor. It's important that you actually go to every visit, because every visit we're taking your blood pressure, checking your urine for protein, which could also be a sign of preeclampsia, and that's how we keep you safe. You also probably are getting weekly testing for the baby. That's important because we're watching the function of the placenta, the amniotic fluid, which is also an indirect function of baby's health, and baby's moving and breathing movements. All of this data we collect to make sure that your pregnancy is safe, even if you're high risk.
Okay. Well, I know one of the big questions that comes up, I haven't seen it quite in the chat, but I do know in the mom world, this happens a lot. Will it hurt to have sex postpartum?
Good question. And everyone at 6-week visit, they hesitate to ask, and I know it's coming, so I just bring it up. The answer is it really depends. It really depends. So I don't lead into it assuming that it's automatically going to hurt. It depends on any lacerations. Have your doctor, well, naturally, your doctor should examine you at 6 weeks. There's nothing specifically magic about that 6 weeks. So if your perineum or your vagina isn't fully healed, you don't need to have sex automatically at 6 weeks. So really take that burden off of you. The other thing is if you're breastfeeding, occasionally I have women who complain of dryness, and that is due to the breastfeeding. Use lubrication, ladies. It is okay. You're feeding your baby. Your body has other priorities. So please feel free to use lubrication. The other thing is just go slow. Again, there's nothing magical about 6 weeks. That means you need to jump right on it. Take your time, cuddle, really get to know your body and your partner again. Sex will eventually come.
That sounds good. I know another question that comes up is, if I have a C-section, when can I start exercising again, or what's safe to do after?
Yeah. So after a C-section, you should be following up with your doctor in about 2 weeks. And that's to check the incision to make sure that it's healing well, there's no signs of infection, etc. At 2 weeks, most of my moms are feeling pretty well. So again, I encourage you to get outside and start moving your body. So at bare minimum, please plan to have some type of walking program. You typically are going to come back in about a month, and that's when we really start talking about getting back into focus and focusing on your core. So often what I have them do is see a pelvic floor therapist, which regardless of you having a C-section, even a vaginal delivery, I think pelvic floor therapists are amazing for our health. Women in France see them automatically. I wish we would do that too. But this is the time that, yes, I would encourage you to start using light weights, get your body moving. You're going to go slow, right? Because you're a little deconditioned, but you can get back to your normal physical activity as tolerated.
That sounds perfect. I know another question that just came up, and I experienced this as well, is a lot of sciatica pain. The woman's at 28 weeks. So is there something she can do to make it better? Is it normal? What to expect as she moves forward.
Yeah, all 3 of my children, I had sciatica, and let me tell you, I am with you. So it's hard to say something is necessarily normal when it hurts so bad, but yes, sciatic pain is really common. What I encourage women to consider is physical therapy, lots of stretching. Again, I'm in New York, I apologize. Lots of stretching. And sometimes women need to use a walker. And I know that doesn't seem so fancy or glamorous, but please consider also using a walker if you need to, because sometimes you can sort of unexpectedly lose your balance, and that can be dangerous. So that's what I would say. Lots of stretching, oral pain medicines are fine, physical therapy, and then use that walker if you need to.
All right. That sounds good. I think there was a few questions about C-sections.
Yes.
Will masks be required for a C-section? What to expect? How to prepare? What are some great thoughts about C-section?
Yeah. So masks, at least for us, we test everyone coming in for COVID ahead of time. So we do allow occasionally women to take off their mask during C-section because it can be a time when there's some anxiety and they just want to breathe comfortably. So ask your doctor, ask the anesthesiologist. Most of the time they're comfortable with that if you're COVID negative, of course. The second thing that I would say is have your doctor walk through the day with you. Everything that you can expect, anywhere from coming in, signing in, getting your IV, sitting up for an epidural. And this is he has like a huge beatbox on his arm, only in New York. Only in New York. Ask your doctor if it's possible. I do this with my patients who have anxiety or it's their first C-section. Get an anesthesia consult so you can speak with the anesthesiologist about what it's like to get an epidural, what you should expect, how long it takes, and get all of those questions out. I think that's a completely reasonable expectation. Having a C-section is sort of an out-of-body experience. And we don't think of it as major surgery per se, because you get this little 7-pound something at the end, right? But it is major surgery. So you should prepare for it as such. And that would include, to me, also having your pain medicines ahead of time so that you can make sure that you're comfortable once you return home. So yeah, talk to your doctor, go through it step by step, meet with the anesthesiologist, and I think that might help some of your concerns.
You know, that's such a good idea to have an anesthesia consult. I had a
Yep.
planned C-section this time, and that would have taken a lot of anxiety because I wasn't sure what to expect. So that is
Yeah.
very safe advice. Thank you. One of the questions that just came up that was very cool was a woman is about to have her fourth C-section and then getting her tubes tied after. How long should she plan to be in the hospital?
You know, actually the same amount of time. When we tie, I try not to use the term actually tie the tubes, because some people have the misconception that they can be retied. So when I discuss that, I usually say we remove the tubes so that they're no longer there. But really, it adds very little time onto your C-section, assuming that there's no surgical scarring. You should expect to be in the hospital the normal amount of time. At my hospital, it's about 4 days for a C-section. So you really should notice the same amount of recovery, the same amount of time in the hospital.
That's so interesting. I actually thought there might have been extra time in the hospital for that. You know, one of the other questions that comes up a lot is, you know, we all have these birth plans that we create and we have these ideas of what we want. How can we ensure that our birth plan gets followed as we enter the hospital to give birth?
So that's so funny, because that was my number 7, birth plan. Love you ladies for bringing that up. Now, I'm talking to you as an OB and as a mother who's had 3 deliveries. My first was vaginal. My last 2 were C-sections. Birth plans. I usually try and reframe them as birth preferences. We would like things to go a certain way. And I think it's important to realize that the baby and the uterus actually run the show when it comes to whether or not we have a vaginal delivery versus C-section. Obstetricians, in my mind, are there to sort of guide the ship and make sure that both of you are healthy at the end of the day. That being said, I find that using the term sort of birth preferences gives us some flexibility and helps us manage your expectations. So again, I would bring the document to your doctor ahead of time. I've had people bring me literally 8-page birth plans. In reality, that's not really feasible to follow everything that's in someone's birth plan. So I think it's helpful to address it ahead of time so we can help manage your expectations and really discuss what it's like to have a hospital birth. And I can explain to patients why we do the things we do. And it really has to do with safety, preventing disease, preventing hemorrhage, and having you and your baby have a healthy and safe experience. So bring your birth preferences, I would phrase it that way, to your physician so you guys can go through it together and really understand what is entirely possible. Some things we do automatically, and maybe you're just not even aware of it. So that's part of the conversation. And what things are really important to keep you and your baby safe.
What would you say is the number one question patients come to you with right before they give birth?
Is this going to hurt? I think is a really common question. I love that question because I go through 10 months with someone and literally sometimes they have this moment where they're like, oh, the baby has to come out now. This baby's got to come out. And so that is one question that always sort of sticks out in my mind. And again, I think it's about reframing how you choose to have the experience. It's a journey, right? It's a marathon. Marathons are painful, they're work, they're effort, but at the end of the day, you feel so accomplished. And so I ask women to let's just go through this experience. Let's see what happens. And at the end of the journey, we're going to focus on that accomplishment, that sense of awe of what your body did, the new addition to your family. My brief answer is we got to just get through it.
I agree with you. You just have to get through it. However, the baby gets here. You just got to get through it. Thank you so much for being here, Dr. Phillips. Make sure to follow her on Instagram at Dr. Kameelah Says, which was also dropped here in the chat earlier. And we'll be drawing the winner of our first giveaway in the next session. So stick around. Thank you. All right, welcome to Breastfeeding 411. While it may sound natural and easy, breastfeeding is often one of the hardest things a new mom will go through, and I can attest to that. It is difficult and it's hard, and I get it. You know, with my first child I had 10 years ago, it was painful, and it was painful for the first month. And then I got through it, and then it just got easier. With the second one that I just had 9 months ago, oddly, breastfeeding was a breeze. So it can be different for everybody and different for every baby that you have. We have someone that's going to help demystify the whole breastfeeding, I don't know, saga, as I call it, experience. And we've got lactation consultant and founder of Milky Mamas, which I have used personally, the leading makers of delicious lactation treats designed to promote breast milk production. And I can tell you, with Max, who I just had, it works. So thank you. Krystal Duhaney, just a reminder for everyone else, drop your questions into the chat and make sure it says panelists and attendees, and we will hopefully address it after we hear Krystal talk about all things breastfeeding. Take it away.
Hi, everyone. Thank you so much for tuning in. My name is Krystal Duhaney. I'm a registered nurse, international board certified lactation consultant, mama of 2 with 1 on the way. And I am here to tell you everything that you need to know about breastfeeding, starting from pregnancy and beyond, so that you guys can have a empowering and supported and educated and informed infant feeding journey. First, I want to start off by saying is that there are lots of ways to feed a baby, and how you choose to feed your baby does not affect your value as a mother whatsoever. So use this information to help make an informed decision on the best feeding choice for you and your baby. So let's get started. One of the first questions that I get in regards to breastfeeding for expecting parents is, do I need to do anything while I'm pregnant to prepare for breastfeeding? Or is there anything that I can do now to help promote my milk production? So that's a 2-part answer. The first answer is really no. Your body is getting ready to produce plenty of milk for your baby, so there's nothing that you can generally eat or consume or anything to increase your milk production in a typical breastfeeding journey. Okay, so the best thing that you can do is relax, take a deep breath, and take a breastfeeding course. If you're like me and you've had multiple children before, when I had my first baby, I saw pictures of breastfeeding parents on on magazines or on billboards, and they would be holding their babies smiling like breastfeeding was the best thing ever. So I figured that would be the same for me. And then when I had my baby, the nurses were like, here's your baby, feed your baby. And I was like, wait, I don't know what to do. So the best thing that you can do for yourself is prepare yourself in advance so that you know what's normal and what's abnormal and what to expect, so you're not shocked when you start your breastfeeding journey. Okay. Also, I want you to know that your body is already producing milk. So around 14 to 16 weeks pregnant, your body starts producing colostrum. You may not leak, or you may, either way is normal, but just know that your body is already doing all the work so that you can sit back and relax. Once you have given birth to your beautiful bundle of joy, here's how you would start getting your breastfeeding journey off to the best start possible. The first thing you're going to want to do, if possible, is do skin to skin. I know that every birth experience is different. So sometimes you may be separated from baby for a bit, or you may not be able to do immediate skin to skin, but do skin to skin as soon as you can. What that does is that triggers that love hormone, that oxytocin that gets you all warm and fuzzy inside. And oxytocin is what tells your body to help stimulate a letdown, which means when your milk comes out of your breast and let your baby know that it's time to eat. Okay, so start your breastfeeding journey or your first meeting with baby right on your chest. And if you leave baby to their own devices, in most cases, your baby will actually crawl, it's called the breast crawl, right to your breast and latch on by themselves. Of course, every baby is different, but it's really cool to try if you have the ability to. Your baby and your body are in sync. Your breasts have these little bumps. If you're pregnant now, you may notice that there's these little bumps around your areola that are getting larger. Those are your Montgomery glands, and those emit a scent that kind of tells baby to come this way. This is where the food is. You also may have noticed during your pregnancy that your areolas may have gotten darker and larger, and that acts as a bullseye. So when baby is born, baby knows exactly where to go. So keep that in mind when you are just giving birth to your baby, okay? Once you have your beautiful baby, we have what's called the golden hour. Ideally, we want baby to latch on, or we want to remove milk from our breast within the first hour, if possible. Like I said, every birth experience is different, right? So if you cannot latch baby on within that first hour or express milk within that first hour, do it as soon as possible. The sooner the better, okay? So if you choose to latch baby on, because what you'll hear a lot from me during this chat is that breastfeeding comes in lots of different ways. Pumping is breastfeeding too. Hand expressing is breastfeeding too. If you're supplementing, that's breastfeeding too. So there are lots of ways to breastfeed. So you'll hear me make that distinction throughout this conversation so that you're not confused. If you choose to latch baby on exclusively or start latching baby on, it's really, really important that you know how to latch, okay? Although we hear that breastfeeding is natural, right? It doesn't come naturally to us. It's not like you just wake up in the morning and say, I know how to do this. It's a skill that both you and baby need to practice. So I'm gonna go over how to achieve a nice deep latch, okay? So take notes, because this is my surefire way to get a nice pain-free latch. Now, when I say pain-free, let's talk about that before I do the demonstration, okay? Pain-free means that you're not having this toe-curling, intense pain with latching. Breastfeeding shouldn't be extremely painful, but it is normal for you to have some sensitivity and tenderness. But your nipples should not be falling off. Cracked nipples, bleeding nipples, not normal, and are usually a sign of either an improper latch or maybe baby has some oral restriction like a tongue tie or a lip tie, all right? But if you think about it, soreness is normal because your breasts are all of a sudden getting lots of stimulation. Your nipples are getting lots of activity. And if you're like me, before I had my babies, no one was touching or sucking my nipples every 2 hours. So now that they're getting all of this stimulation, completely normal to have some soreness or tenderness. If you notice cracking or bleeding though, it's time to revisit that latch and make sure that we're checking with the lactation consultant for assistance, okay? All right. So let's get started. Let's practice latching. If you have a baby at home, you can practice with me. If you don't, again, just take notes, or you can always send me a message on Instagram and I'll definitely go over it again with you, okay? All right, so I got my big boob here. Okay, so, and my baby. The first thing you're gonna notice that I'm doing is I am supporting my baby's, the back of my baby's neck. I'm not pressing on baby's head. You want baby to have free neck movement, but you want their head and their neck to be supported. If you press on the back of their head, it prevents them from opening nice and wide. And we want baby to open nice and wide before we initiate a latch, okay? So I'm just gently supporting the back of baby's skull here. Notice that I'm also resting my forearm against their spine. This helps them feel nice and supported. Sometimes, you know, babies are new to this world or they don't know too much about gravity. So if we don't support them, they may feel like they're falling, and that can make them not relax, which can make it difficult to latch. So make sure baby is nice and supported. For extra credit, you can take their little feet and press their little feet against something. So if you have maybe the arm of a couch, or if you can fit it in your forearm, just giving them something to press or brace their feet against really helps them feel more secure, okay? So that's the first thing. Baby's nice and supported. Also, you're gonna notice that baby's belly is touching my belly. You always want baby's belly touching you. You never want to initiate a latch with baby's belly facing upward, and I'll show you why. If you have baby's belly touching upward, facing upward, the baby has to turn their head this way to latch. It's not very comfortable, right? So like imagine I have my water bottle here. If I have it right in front of me, super easy to take a drink. If it's over here and I have to turn my head, that's not so comfortable. So keep that in mind when we're latching baby, okay? Belly to belly. All right, now let's talk about our breast. When we're latching baby on, although it's called breastfeeding and we often think that baby's sucking on our nipple, they're actually latched onto our areola. Our areola is the circle part here around our nipple, okay? So we don't want baby latching onto our nipple. We want baby to have a nice open wide mouth latched onto our areola. It's a common misconception that baby has to get all of your areola in their mouth because we all have different anatomies. Some people have really large areolas and some people have tiny areolas. So we just want baby latched onto our breast tissue and not our nipple. Remember, we breastfeed, not nipple feed, okay? Alrighty, so now that I have my breast here, I am going to have my baby belly to belly, right? Supporting the back of baby's skull. Sorry, baby, let me turn your head. Supporting the back of baby's skull, not their head. And I'm also supporting my breast here. Keep in mind that I'm supporting my breast behind my areola. I'm not here squeezing the nipple. A good way to keep that in mind is you're gonna take 2 fingers, put it right here at the base of your nipple, and that'll give you an idea of where to put your thumb. See that there? So you're gonna take 2 fingers, put it right at the base of your nipple, put your thumb right where that ends, and that gives you a good idea of where to place your thumb. You're then gonna take the rest of your fingers and just wrap them under your breast, okay? Next, what you're gonna do is you're gonna gently compress your breast down, okay? Imagine your breast like a sandwich. If you have a really large sandwich, it's very difficult to get a good bite of that sandwich or get a lot of that sandwich in your mouth. But if you squeeze that sandwich down, it's much easier to get a good amount of that sandwich in your mouth. So we're gonna make a breast sandwich with our breast so baby can get a good amount of our breast tissue in their mouth, okay? Next, what I'm going to do, and I'm gonna turn this way so you guys can see, is I'm going to align baby's nose with my nipple. That's very important because you want baby to open wide. And if you align baby's mouth with your nipple, they just have to open a tiny, tiny bit because your nipple is right there. But if you align baby's nose with your nipple, then they have to open wider in order to get their upper jaw over the top of your nipple, okay? And that helps promote a nice open wide mouth. All right, so belly to belly. We're making a breast sandwich, squeezing our breast, right? Then what we're going to do is bring our baby to our breast, okay? So I'm gonna gently compress and I'm going to tilt my breast upward and I'm gonna rest it right here on the top of baby's upper lip, like on their Cupid's bow. Putting pressure right here is a signal to baby that it's time to eat and to open wide. Once baby opens wide, this is very important. You want to wait until they open wide because if they don't, it's going to hurt. And I promise you, you're going to have to restart the latch. So just be patient, right? Once baby opens wide, you're going to drop the bottom of your breast into their bottom jaw. And you're going to do a little scoop. You're going to scoop baby up and over the top of your breast, of your nipple, so that they can get the top of your areola into their mouth. You see how that is? That should be relatively pain-free. Once babies latch, it should feel like a tuggy pulley, not like a pinchy, bitey, sandpapery, if that makes sense, okay? Tuggy pulley is okay. What you should also see is you should see baby's chin buried into the bottom of your breast. And you should see that there's a nice gap between your breast and baby's nose so that their airway is nice and clear. You should also see their upper lip is either lightly flanged or neutral. We don't want their upper lip tucked like grandpa, okay? If it is tucked, you can just take your thumb and just kind of flip their upper lip up to kind of flange it out. If they have trouble keeping that upper lip lightly flanged, then I would recommend maybe getting it checked by a lactation consultant just to make sure there's no restriction there, okay? Once baby's latched on, you should start seeing them do their, I'm gonna show you guys with my little puppet here. Once baby is latched on properly with their lips lightly flanged, you'll start seeing them suck really fast and really shallow. That's called nibbling or non-nutritive nursing or suckling, okay? They're not actually getting milk right now. They're just suckling. And what this does is it provides nipple stimulation to help stimulate your letdown. Your letdown is when your milk comes out of your breast. Some of you may feel it, and it's described as like a tingly kind of pins and needles, maybe. We all have different feelings of letdowns, and some of you may not feel it. Either way is normal, okay? Once your letdown starts and your milk starts flowing, baby's nibbling will transition to a longer, wider suck. Can you guys see that? So their chin will drop for about half a second, and that means that they're taking a big gulp of milk, and then it'll close. So longer gapes and close, longer, instead of this nibbling. Throughout the nursing session, they'll kind of go back and forth between nibbling and longer gapes. If you start noticing though that they're just nibbling and not really actively nursing, what you can do is take your hand and just compress your breast. That will squirt a little bit of milk in baby's mouth to say, hey kid, remember that we're eating. let's keep on task here, okay? Each nursing session varies. It depends on your baby, but your baby should be nursing for about 10 to 25 minutes, sometimes a little longer. If you find that you've been attached to your baby for an hour and then you unlatch and baby's screaming hungry, that could be a sign that baby didn't get a lot of milk during that session and they're still hungry. So you want to make sure that you're kind of keeping an eye on how long it's taking baby to finish your nursing session. And also you want to keep an eye on if they're satisfied, okay? So that's latching. If you guys have questions, please send me a message. Remember, soreness and tenderness is normal. We all have different pain thresholds. So soreness and tenderness for me may be pain for you, but what we don't want is cracked, bleeding nipples. We don't want pinched nipples. We don't want your nipples to look like a fresh tube of lipstick where they have that pinched tip after unlatching. Additionally, we don't want pain throughout the entire nursing session. The soreness and tenderness is okay and is normal and expected right in the beginning with that initial latch, but once baby gets going and once the nursing session has been established, that pain or soreness and tenderness should subside, okay? Another important question is, how often is baby gonna eat? Remember, your newborn is growing very rapidly, okay? So they're gonna wanna nurse very, very frequently. In the beginning, they go through what's called cluster feeding, okay? And that's gonna feel like you're attached to baby all day. It's gonna really feel like you have a lot, like you've been just nursing and breastfeeding all day. For the first couple of days, sometimes even a little longer, your entire life is gonna be feeding baby and helping them grow, okay? Completely normal. After a while, your milk supply will regulate after the first couple of weeks or so, and baby's nursing pattern may change, but baby goes through frequent growth patterns and growth spurts throughout their life where they may start cluster feeding again, and they'll want to nurse more frequently. So the best thing that you can do is watch the baby, not the clock. Feed your baby on demand and not on a schedule. Does that make sense? Okay. Another important question I get is, how do you know if baby is even getting milk, right? Because when we're breastfeeding, we can't see the milk going in. We can't see how much they're taking in. So it's kind of a mystery. So here's how you know if baby is getting plenty of milk. For the first week of life, meaning from newborn to day 7, baby should have at least one wet diaper for every day of life. So when they're 1 day old, they should have one wet diaper. And by wet, I mean urine. When they are 2 days old, they should have 2 wet diapers at least, and so on. By day 7 and here on out until the end of time, they should consistently have 6 to 8 wet diapers per day. That's a good sign that they're getting plenty of fluids. If it's not coming out, then it's not going in, right? Additionally, by about day 4, depending on the type of birth that you had, if you were separated from baby, those types of things, their meconium, which is that dark green poop that they have as a newborn, should transition to a yellowish seedy poop, okay? And it should be nice and soft. If that's happening by about day 4, sometimes day 5, then that's a great indication that they're getting plenty of milk during that first week. Another thing that you can do for extra credit in that first week, and I love this tip, and this really helps getting your breastfeeding journey off onto a right foot, is that after every nursing session, you're going to hand express. I encourage every breastfeeding parent to learn how to hand express because it's a great way to remove milk and it's free. So to hand express, what you're going to do is you're going to grab your breast, you're going to gently compress and squeeze backwards into your chest wall, compress forward and release. And you're going to do that a couple of times, and then you'll start noticing that your colostrum, if it's the very beginning, or your milk, your mature milk, which is the whiter, creamier milk, comes out of your nipple. And you'll just keep doing that. And that will help. If you do that after every nursing session and collect your colostrum on a spoon or in a medicine cup and feed that to baby after every nursing session, like dessert after a meal, if you can remember, that will help make sure baby's getting plenty of milk. It also stimulates your milk production and make sure that you guys get off to a good start. So if that's one tip that you can have after giving birth, I recommend that because it's a really great way to get things going quickly, okay? Alrighty, so that's our first week. Let's talk about weight loss. It's expected or considered normal for your baby to lose about 7 to 10% of their birth weight right after birth, okay? So don't let that freak you out, but you wanna make sure that baby is still meeting all of those signs of getting enough milk that I mentioned to you. By about day 10 to 14 after giving birth, your baby should be back to their birth weight. If you're noticing that their weight is still declining and their diaper output is declining, or they're not having bowel movements, or their bowel movements are formed and not soft, those are indications baby is not getting enough milk and you want to get help right away. And you'd likely need to supplement to make sure baby is getting plenty of milk. Remember, there's nothing wrong with supplementation, okay? Supplementation and breastfeeding is breastfeeding too. So if you need to supplement in the beginning, just until you get things going, that's okay. But make sure you work with a lactation consultant to make sure that we're maintaining our supply when we're supplementing baby, okay? So now let's say you've decided that you don't want to nurse, you'd rather pump, or latching is too difficult for you and you just would think it would be easier to pump. Exclusively pumping is an option, and it's breastfeeding too. Feeding your baby breast milk, no matter how you do it, is breastfeeding. So let's briefly talk about exclusively pumping right after birth. So right after birth, your body's making that thick antibody-rich colostrum that we call that liquid gold, right? It's super thick, and sometimes most pumps have a difficulty removing your colostrum from your breast. So if you start off pumping right away, you may get a little discouraged because nothing's coming out. So what I recommend right after birth is to hand express. So you're gonna hand express every 2 hours or so, and then follow that with a pumping session. Hand expression will help remove the colostrum or milk from your breast, and the pumping will help stimulate your milk production and stimulate your breast to make more milk. So we're gonna do that for about the first 4 days or so until your milk volume increases or until your milk comes in, as we like to call it. Okay, there's nothing wrong with pumping, and it's a great way to supply milk for your baby. If you choose to pump in addition to nursing, you can do that too. However, keep in mind that any extra breast stimulation that you're giving to your body is telling your body to make more milk, and that could lead to an oversupply, which isn't as fun as it sounds, right? Okay, so one of the most important things if you choose to pump, or if you plan on pumping at any time in your breastfeeding journey, which a lot of us do, especially here in America where we have to go back to work super early, unfortunately, is to make sure that your flanges are the right size. If you're like me, when I was a new parent, I just took the pump out of the box, plugged it up, and started using it. I had no idea that flanges, what they were, and that they needed to be fit for me. But you have to keep in mind is that every body is different and we all have different anatomy. So flange sizing is one of the most important tips that you need to know if you're gonna pump at all. Okay, I'm gonna show you how to do it. Alrighty, so we have our breast, right? And we remember our brief little anatomy lesson from earlier. Areola, nipple, okay? So we're gonna take a measuring tape. It can be this one or any one, and you're gonna measure just the width of your nipple. from here to here. Can you guys see that? I know you can't see the numbers, it's super tiny, but just giving you the idea. You're gonna take that number and convert it to millimeters. And you're gonna do this before nursing or pumping, okay? And whatever number you get, so let's say I measured in inches, okay? So if you measure in inches, just take that number, type it into Mr. Google and ask them to convert it to millimeters. So let's say that you got 13 millimeters for your measurement on this breast. You're gonna add 3 to 4 millimeters to that number, and that will give you your best start with your flange sizing. So adding 3 to 4, I get about a 16 to 17 millimeter flange. That's what I'm gonna start with on this breast. I'm then gonna measure this breast. The reason why is because your breasts are sisters, they're not twins. It's very normal for you to have one breast that needs one flange size and another breast that needs another flange size. So make sure you measure both, okay? Then you're gonna go and buy those flange sizes, and that's the flange size you're gonna use. You're gonna test it for comfort. Is it comfortable? Is your nipple rubbing against the inside of the flange where it's causing friction? Is your areola getting sucked into the flange? That might mean your flange is too large. What's your milk output like? Has it increased or decreased? That's how you can determine what your flange size is like and if it's the right flange size for you, okay? One thing to notice though is that if you're measuring right after giving birth, a couple of weeks after giving birth, your hormones will regulate and your nipple and areola size may change. So it's a good idea to measure every time you notice a change in your milk supply, or maybe every couple of months, just to make sure that you're using the right flange size, okay? All right, so we talked about pumping and nursing for that very first week, okay? Now let's talk about what do we do after the first week? How do we maintain our milk supply after that? For the very first week, you wanna make sure that you are pumping or nursing about every 2 to 3 hours or on demand, and that will help maintain your milk supply and make sure that you have a wonderful breastfeeding journey.
All right, I have a question for you. And I
Yes.
think this comes up a lot is, how do I know that, when I pump, for me personally, when I pump, I get about half an ounce out, but I also have a healthy growing boy. So when I breastfeed, I get about 4 ounces per boob. Is there a correlation between pumping and output of breastfeeding from the boob?
Yes, so do you mean like when you nurse, you get a certain amount?
Yeah, so I weighed him before I nurse, and then
Okay.
I weigh him after just to make sure, because when I pumped, I literally get drops out for some reason.
Okay. So when you're pumping, there are so many things that go into pump output. Flange size, like I mentioned, if you're using the wrong flange size, which most parents are, then that can affect your pump output because it's like having a bad latch. It can't remove milk from your breast effectively. Additionally, if you're stressed out while pumping, like most parents are, if you're staring at the bottles while pumping, I know that you all do it. I know that you do it, Vina. You stare at the bottles while you're pumping. That makes your body really stressed, increases your cortisol, and you kind of tense up. If you just take a nice deep breath and relax, you'll allow your body to relax and your letdown will come faster. So stop staring at those bottles. Additionally, know that your baby in most cases is more effective at removing milk from your breast than your pump. Because again, there are so many factors that affect your pump output. Also, you want to make sure that your pump parts are in good condition. Those need to be changed about every 30 days or so, depending on the type of pump and how often you pump as well. You also want to make sure that you're massaging your breast while you pump to help remove as most milk as possible. So I would say don't worry about your pump output, especially if it's after nursing. The average pump output after nursing is about 1/2 ounce to 1.5 ounces combined. That's both breasts together. If you're replacing a nursing session, the average pump output is about 2 to 4 ounces combined.
So a couple questions that have come up. Do you need to supplement vitamin D drops if you're breastfeeding?
That's a great question. So although breast milk is just amazing, it's really, really amazing for baby, it doesn't have a lot of vitamin D. So there are a couple of ways that you can supplement vitamin D, especially if you live in a state that doesn't have a lot of sunlight, or if you have darker skin like me where you don't absorb a lot of vitamin D from the sun. You can either take 6,400 international units of vitamin D yourself. There's studies that show that if you take that much, that you would supplement yourself with enough to supplement baby through your breast milk, or you can buy the drops of vitamin D and drop them into baby's bottle. drop them on your breast before latching or those types of things.
Perfect. I know one of the big questions that comes up too is if I'm not, but if I was pregnant and I am nursing a toddler, does that affect the fetus that's in my belly? Is it safe? How long can
that's
I
a
do
good
it?
question. So in most cases, again, this is a question usually for your healthcare provider because you want to make sure that you're not high risk. But a general rule of thumb is that if you're safe to have sexual intercourse while you're pregnant, then you're safe to breastfeed. Because the reason that they say not to is because when you are breastfeeding, it causes that oxytocin to flow and it causes some uterine contractions. Same uterine contractions that you may have during intercourse. So if you're cleared for sex, you're cleared for breastfeeding. And you don't need to stop. You can continue nursing throughout your breastfeeding journey as long as you're cleared by your physician. And then once you give birth to your baby, your body is so amazingly smart that it knows that you have a newborn. So you'll make colostrum for your baby. I've even seen new parents make colostrum on one breast and mature milk on the other breast for their toddler.
That's amazing.
It
is amazing. I know another thing that comes up a lot is, sometimes, at least I had this with Max, who I had 9 months ago. I had a plugged duct in my armpit, which was really awesome. Almost, I would say right when I came home from the hospital. What are some great ways to either know that you have a plugged duct, get rid of the plugged duct, or know that you're on course for mastitis, and what do you do?
Plugged ducts are no fun. Usually they have a cause. So what I usually tell parents first is, let's work on treating it, but then let's work on treating the cause so that we don't get them again. So usually plugged ducts are caused by infrequent or ineffective milk removal, meaning that we didn't nurse enough, or we didn't pump enough, or we didn't do it effectively. So we didn't remove milk effectively. Sometimes you can also get them if you're wearing a really tight bra, if you are wearing like maybe an underwire bra and just putting pressure on a milk duct, that can sometimes cause some plugged ducts too. A couple of things that you can do to relieve them are massage. I love massaging. It really, really helps. Vibration, anything that you have that vibrates, wink, wink, or a mechanical toothbrush that you have, you can put that on the area. Warmth, like a nice moist heat can really help. Dangle nursing or pumping. So basically you would be on all fours where your breast is hanging downwards. And then you would nurse baby would be laying on the floor or so, and you would nurse that way or pump that way and use gravity to help dislodge that clog. You can also take sunflower lecithin, which has been shown to help emulsify, which is like break up the fat that's causing that clog. And you can take that and that will help dislodge the clog as well.
Amazing. Well, I think that's all the time that we have. And I know that we could talk about feeding baby and breastfeeding for forever. But just as a reminder to everyone watching, we are recording this, so you can definitely get more information. But if you want to talk to Krystal more, which I know all of us do, you can find her on Instagram at Milky Mama LLC. So if you need more about the ins and outs of breastfeeding, totally DM Krystal and she will answer more than all of your questions. So thank you so very much.
Bye guys. Take care.
All right, now we will be drawing the winner of our first giveaway package, which includes the MeQ Care Baby Monitor, which I can say is incredible, a DockATot nursing pillow, and a gorgeous Tiny Tags necklace. And the winner is Janelle Barnes. Congratulations. You have just won the most amazing giveaway. I think that we will find you in the chat and we will get you all set up. So congratulations, Janelle, that's amazing. All right, you guys need to stick around for our next giveaway drawing at the end of the next session. So stay tuned for that. Now, it is finally time for Baby Care 101. You have your precious bundle of joy, but now what? Lucky for us, we have the amazing Connie Simpson, aka Nanny Connie, who I have followed for a long time and is amazing. A childcare expert with over 30 years of experience who has worked with tons of celebrity parents, including John Krasinski and Emily Blunt, Justin Timberlake, and Jessica Biel. And she shares all of her insider tips and tricks with us. Just a reminder that if you have any questions like the other two sessions, just go ahead and drop them in the chat. Make sure it says to panelists and attendees, and we will try to get all of your questions answered. Take it away, Nanny Connie.
Thank you. Oh, see, am I in?
You are.
Okay, I'm sorry.
Our technology is
I'm
like
looking right at you, so like it's a pleasure to see you and to be with all of the parents here today. And thank you so much for having me a part of the panel. You know, it's just truly amazing to hear all of the speakers on this panel speak with us and give parents that security which is needed. This is Mental Health Month, and I think more than ever, parents need to know, stepping back into the COVID, coming out of COVID and coming back into the real world, that they do have the support and everything that they need from their village. My mantra always has been just be the parent. And in just being the parent, it means that you have confidence in yourself in the midst of all of this. So don't be afraid to trust your instincts with your new one. I can only amen everything the doctor and the lactation consultant has said to you, because it's all the truth. And it's really hard when you become that parent and bring that bundle of joy home. Now what do I do? Because I had so many people talking to me and so much information being given to me that I was saying, but when I get home, it's like, now what? And my partner and I both look at each other and you both will go, now what? You have to remember that there are many things that you should be taking care of prior to that baby coming home. The first thing that you need to do is to make yourself, as the doctor said earlier, make yourself a list of things that you want to do and need to do. And listen, know this from Jump Street. You can want everything to be perfect all you want, but it's in somebody else's control. It's between the baby and your body, how things turn out here. And that is the understatement. So to be ready for that, you need to get your groceries together before you come home. Figure out your meal plan, because if you're a breastfeeding mother, or if you're a mother that's coming home and you've had a C-section, or just being in that moment of having that baby and coming home from the hospital, that hospital food or that person who's bringing your meal is not coming home with you. So you need to make sure that that refrigerator is totally stocked out the way that you want it to be. If you have a pet and that pet is your first baby, make sure you have a plan for that pet, so that when you come home with the baby, you don't have to worry about, now I need to pick up right where I left off. No, that's not what you do here. So that plan details every little minute move that you have made prior to that baby, to the point of, now I am back up on my feet. Because as everyone has said before you, rest is so important to you and to that baby, and to you being able to function with the baby. I always say you need to have a dry run on everything, putting the breast pump together, putting the car seat in the car, going to your pediatrician. You should go to your pediatrician before that day for that first visit. You need to go and see if there's a well room. You need to see how it functions. You need to meet all the doctors in the office so that you are comfortable when that moment comes and you're not sitting there going, well, they didn't tell us this. Filling out all of that paperwork takes away that anxiety. You will have so much anxiety when that baby comes home, because you're just wondering, can I be the best that I can be at this moment? Another thing I always tell moms is to get you plenty of outfits that you are comfortable in. Now, your favorite pair of jeans are your favorite pair of jeans. Don't cut the tag out of those, but get you 2 more pair of jeans, cut the tag out of those jeans so you don't measure yourself. It's about you being comfortable, and you put on whatever works on that day. This is Mental Health Month, and it's about your mental health as being a mother, to be able to produce, to be able to function in your home. You need to also sit down with your partner and have trigger words and let them know what those trigger words are, so that when you do feel like, I'm overwhelmed, I can't do this, we've talked about it. And when you say ice cream, then okay, mom is stressed and now I need to step up. I think baby showers are really great for all the family and everyone to see all the stuff. But I think it's more important to have a daddy shower so a dad can understand what's about to happen. I have a book, and my book is, and I'm saying this because my book doesn't talk at you. It comes to help you understand that this is a fourth trimester that you're about to step into. And in stepping into that fourth trimester, that means you need to have a village. You need to make a list of people who are going to be in this village. You need to explain your needs that you want them to help you with in the village, and they need to be on the same page with you. I have now been more active as a virtual part of People's Village, and you can go to my website and get more information about being me still helping parents to be a part of the village, because I think it's super important for someone to go, now what? Well, no one told me about the bilirubin count. Well, no one told me about a PKU test. No one told me about like the lactation consultant that I needed to go. No one told me. So now there are places that you can find that kind of help. And I do have a spot to help those in those kind of situations. It takes a village. Don't stay on an island all by yourself. That's not where you need to be, because you have to heal from the inside out. It took you 9 months to grow this new human being. It's going to take you at least 9 months and then some to get yourself back. And everyone who's a part of your village needs to know that that's what's about to take place. Because you are up and you're mobile and you're able to do stuff, that does not mean that you're healed. Postpartum will come in different ways. You will look at something and go, I don't know why I'm crying, but I'm crying because that's the way I'm feeling at this moment. And your partner needs to know that they need to give you that touch. Touch is so important, as the lactation consultant said before, not only for that baby, but for that mother, because you have just been through a hell of an experience, and you need to know that your team is there for you. I am Nanny Connie, and I have seen it over and over and over again. It doesn't matter what status you come from or where your house is located. Being a new mother is hellacious, and having people around you is so very important. And now I'll answer any questions that you may have.
Wow. I mean, I guess I wanted to remind everybody, just as a resource, because I just had, my second son 9 months ago, is that Nanny Connie has an amazing book, The Nanny Connie Way.
Right.
And not able to read it, which I understand when you're nursing a baby, you're feeding a baby and diaper changing up all night. The audiobook is also invaluable. So I just wanted to put that in there because it's something that I have used and I love. So thank you, Nanny Connie.
Oh, you're so very welcome.
Yeah, I mean, I think there's a lot of questions for you. Like, how do you know that you need more support, or when is a good time to reach out to someone like you?
I think you and your partners should do this research prior to the baby coming home. It's your second pair of hands. And now that COVID is about to be in our rearview mirror just a little bit, we're about to get back into the workforce. So having that someone who understands your protocol and wants to be a part of your team is truly important. And both parents need to be on board with this. They need to talk to this person. They need to put down, what their concerns were and what they really liked about them, because they're about to take care of your most prized possession. So just like having a baby shower, you should sit down and figure out how often can we have someone come in and who this person is going to be. I think picking a nanny is truly, or a baby nurse is truly important, because you are on that emotional roller coaster and everyone's not a fit. Most people, they look good, but then when they get home, I've seen baby nurses who will say, I need to be off at this certain time. But at that moment, mom is dealing with an engorged breast, and they need to know these kind of things. So talking to someone prior to the main event is truly important.
I agree with you. I think one of the biggest questions that comes up, as we become new moms is how do we soothe a crying baby? I mean, that can be so jarring when you're trying to soothe the baby. What can we do?
And in soothing a crying baby, a baby cries because they don't have a vocabulary. Their cry is their vocabulary. So the most important thing is skin to skin. To hear your heartbeat, to know that you're comforting, that you're being comforting, that you are calm. You have to remain calm in the situation. You don't have to sway as much, but just that gentle pat and to gently massage their back and them feeling your heartbeat because they've heard it for 9 months and they know your smell and they say, okay, mom's okay, I'm gonna be okay. So that's important. Remove yourself from all the noise that's around you and sit very calmly with your child and they will calm down.
Okay. Another big question that comes up, and I want to know the answer as well, is how do you help a baby soothe them to sleep or get them to fall asleep on their own?
I think this is really important because a lot of parents are in the midst of trying to sleep train. Sleep training is really a tricky situation because teething comes along. Parents want to start really early with it. And then you kind of feel like I've been a little derailed, but you're not. I think there's a window, there's a cycle. Every 3 hours a child is up, then they're ready to go down. So the older they get, the bigger the window is. The smaller they are, the smaller the window is for them to be up in the cycle of being awake and then going down for a nap. That's why children have 2 naps a day. Then they merge it together and they have 1 nap a day because they've gotten older and they're able to stay up longer. So I think it's just truly important to pay attention to your child. If you've been up with an infant and they've been up 2.5 hours, then you're coming within that cycle for them to go back down. So a lot of parents think, well, they're on my clock. No, you're on their clock.
I love that. What's the number one piece of advice you give new parents?
Not to have your expectations so high and feel like you're a failure because every child is different. What you did with your first child, you won't be able to do with your second child. That's because that's a different human being. If we were all cloned, then we'd be okay. We're not all cloned. We come into this world with our own uniqueness. So prepare yourself for that child. They're going to have your idiosyncrasies, you or your spouses, and just be ready to get up every morning and put on your armor of patience for that child because they're going to try you. No matter how small or how large they are, they're going to try you and you are their parent. And that's why I always say, just be the parent. Stand strong in who you are because you're their protector. And your information that you give them, it's not wrong. It's just you trying to maneuver yourself through that stage of life with that child.
I agree with that. I mean, I feel like you're like a baby whisperer. So are there any go-to products that you use or recommend that every new mom has? Okay.
Yes. I was listening to the lactation consultant talk. I love the Haka. I think mom start off and they're breastfeeding and they don't have, I can't tell you the number of moms who are not my clients, but they will reach out to me as Nanny Connie, can you help me? The Haka is so amazing. When you're feeding on one side, it actually helps the other side to release itself and to go down. There are so many simple things that a parent can do. So I love the Kakuna baby. I think parents hold their babies and want them to feel cuddle. The Kakuna baby helps the parents with that situation of being able to put it into their little bassinet, something that they can hold on to. My book is something that will help a parent because it's not giving them like a direction to say, I'm a failure if I don't do this. I'm actually holding your hand to help you know, no, you're doing a phenomenal job at the moment that you're in. So let's continue and see how it can be tweaked. So I think those things, I love oh my goodness, the pump. I'm trying to think of it. Oh, I'll come back to it, but there's a pump that I like, that's really good. It's because all moms feel like that they are a cow. They always say, all I do is pump, you know. well, well, you don't. And you are giving a benefit to the world, because you're giving a child to this world that's very protected. I love little sleep sacks. I think parents try to overdo it with their kids. You don't need a lot in the very beginning with your children. You need the little sleep gown so you can go in and out really quick. You need to be a ninja when you're taking care of your little ones, because you want them to continue in that sleep cycle. Diapers are really good. The bathtubs with the slings, I think those are phenomenal, because it helps to give a parent that confidence that they can, especially it involves the dad. The dad can be a part of it. So the Spectra, that's the one that I really love, the pump. Because moms stay so connected to the pump, the Spectra doesn't give that overwhelming, like, I'm here once again. And I think a mom needs to have a journal. A journal is so important for a mother, because baby brain is real. I've been doing this for over 35 years and I have baby brain. I'm trying to remember, like, what side, what time, and what time did you eat? You know, so those kind of, people think I need to finish the baby room. No. You can have a dresser drawer, diapers, swaddles, bird cloths, and diapers for your babies behind, and you're good. You're so good. So I think those things are some of the things, and some of it I haven't even, a bottle. I like the Komotomo bottle, because it kind of gives a parent that baby that, like, I'm still attached to my mother's breast. I like the Dr. Brown's for moms who are dealing with the gas. I could go on and on. Gas drops are something a child should always have. You need to always, because even when they start eating foods, they have that acid from the food that they're eating, and they can't burp like us. Take the time to burp your child. Lay them out. They should be limp noodles, and that's when you know that you have got really good burp child. When your child's legs are limp, when their arms are limp, and they're just laying there across your shoulder blade. So those are a few of the things that I really like.
I mean, they sound good to me as well. I know one of the big questions that keeps coming up is, do you have advice for people going from one child to two?
Oh my goodness. This is so important. I think in the very beginning, before that child comes home, we need to talk about and celebrate the joy that's about to come into the home. Let them know that now that you're here, we're going to have someone else, because we love you so much. Talk about it throughout your whole pregnancy. Before the baby comes home, let them, if possible, I know in the midst of COVID, it's really been kind of hard, but let them, if possible, go to the hospital to see mom and see where it all transpired at. And when the baby comes home, have a little gift from the baby to the big brother or the big sister to let them know, man, I'm so happy that you're my big brother or my big sister, so you can show me the ropes of this new home. Even with having a pet, I recommend taking the blanket from the hospital home so the pet knows that this new addition is about to come to the house. It's important. So I always tell my parents, make a calendar to have certain dates to continue to have time for that older child. When you have someone come into your home to help you, I think it's more important to let them help with the baby and let you continue with that older child, because they are recognizing the difference in the house and you want the routine to remain the same. The baby wants warm arms, someone to change their behind, and someone to feed them. And they're okay, they're loved. So in the midst of your day, do get your rest, but the majority of the time, if you can, spend it with your older child, because If they're younger and you've started potty training, there's going to be a regression. No matter what it is, there's going to be some sort of regression because they're mad at you. You know, now you brought someone else in, and what am I, chopped liver? So the thing you need to do is to continue to keep them at the forefront and keep up with your schedule. Don't give in over and over. Well, the new baby's here, let's do this. No, because now you're setting them up to say, well, this is the new way. This is how things can be. So stay as you were before that baby with your routine and how things go down so that your child is going to continue with the pattern no matter what. Those are a few things that I talk about. And then with the calendar, if they're an older child, I always tell parents, let them know throughout the day, have a little time for them. But if they can't read, take a color and say, when this color shows up, this is your day. And you take that older child out for whatever it is, and it's one-on-one time. You can't do it collectively together, but to do it individually, you will be heard, they will hear you, and you will have a better relationship. No matter how old your child is getting, you need to always have one-on-one time with each child that's in your home. Because even you, what do you ask for? The first thing that you ask for is what? Date night. And that's date night with your husband. And you should have that. I always tell my parents, go out on a date, don't talk about the children, and reconnect, because that's how your family got here. And that's truly important. Date night is super important because you spend all your time over your breast, feeding the baby, and that's a lot.
Do you have advice, for partners? As we go through this, having their support and having them feel needed is so crucial. What sort of advice do you have for them?
I think it's truly important for, as I said in the very beginning, we think about baby showers. I think there needs to be a shower for a father or the partner to see and hear all of this, because, they don't know. The beauty of me being in the home is I recognize a lot of the things before they happen. And that's what a baby nurse should do. They should recognize this to say, hey, you need to do this because she's feeling this kind of way. Or to make that connection stay, because a lot of parents do drift apart. When a new baby comes into the home, things have changed. Your life will never be the same. It will be better for you and your enrichedness down the road, but in that moment, it won't be the same and you will feel torn apart. So it's really important for the spouse or your partner to have some kind of group or get some kind of information. Again, something that they're reading, or to listen to Nanny Connie, or have some kind of viral situation that they talk to someone to help them to know, listen, she's going to have engorged breasts. She's going to be up most of the night. Breastfeeding is, yes, it's her, but it's also you. So be attentive to her and make sure she feels that she's still important, as opposed to dismissing her. Feed her. Make sure that her pump station has all the little amenities to help her when she sits down to feed or pump. And those kind of things go a long way. And if you don't tell a person, they don't know. So it's important for them to have some kind of, I would say, jogging or some kind of class before, to let those partners know. Because a lot of fathers say, well, she didn't tell me. Well, I didn't know. And they're kind of right. They're so kind of right. So I think that's important for them to know that it's a fourth trimester. Keep that in mind. There's a fourth trimester. And you both walk through this fourth trimester with a little being connected to this whole fourth trimester. So
how would you say, I think for our last question, how would you kind of divvy up the responsibilities of having a new parent through the fourth trimester so that both people are doing something, and that way it's a shared responsibility?
I think that, I think that parents have strong suits, and you should play to your partner's strong suit. If they know what belongs in that refrigerator, then the grocery run is their strong suit. If they know where the kids go to school, which they should know, then they do the bus run with the kids. They take over your calendar with the other children or whatever is going on in that house, and they learn more about what you do in that home as opposed to just being a part of what you do in that home. So I think playing to the strong suits is so helpful to both parents. A lot of parents will say, well, my he didn't load the dishwasher right. Well, he didn't load the dishwasher right because he didn't know how the dishwasher was loaded. And this is just a prime example to tell you, to let you know that playing to a person's strong suit, and don't complain. They're there to help you, and if they're helping you the best of their ability, if they don't know how to fold the clothes, they got them out the dryer. But don't use that as, well, I don't know how to do it. And I think that's the other thing that partners do is like, well, she's breastfeeding, so it ain't on me. It is on you to go to make sure the house is stocked out, to make sure that all the other things that make that house run are important. So in the very beginning, before you have the baby, let's find out what your strong suits are and let's agree. So we don't disagree when I'm hormonal and on that ride. This is so important, and I don't think it's talked about enough. And a lot of partners and mothers are just like, I didn't get any help or no one's there. When I grew up, there was a village. The village now has to be recruited in. When I was growing up, the village showed up before I even left the hospital. My aunts, my cousins, my mom, these people were there. Get a doula, get someone who can be in that hospital to say your needs. And from that moment all the way to the end of that 4th trimester, don't walk alone, sister girl, don't walk alone, father. Just walk together and walk with whomever is in that village.
Well, thank you so much for your wealth of knowledge, Nanny Connie. You can find her on Instagram at Nanny Connie.
Yes.
And like I said, your book is amazing. So I'd highly recommend The Nanny Connie Way, both on Audible and in paperback. Very, very crucial to have. And thank you for everything. And on that note, we have the winner of our second giveaway package, which includes a Jujubee Deluxe Diaper Backpack, which is awesome, a $70 gift card to Milky Mama, Hegan Bottle gift set, Dewy slip shoes, an Ergo pouch matchy robe, and cocoon swaddle. And the winner is Kristen Lewandowski. And hopefully I said your name right, but congratulations. We will connect with you via email that you registered with, but congratulations again. That is quite the amazing package. So congratulations. All right, make sure you stick around through our next speaker so that you can be eligible to win our next giveaway. All right, if you're like most first-time moms, you've definitely heard of a doula before, but may not be exactly sure of what a doula does and if you need one. That's why we're so thrilled to have Meyer, a certified birth doula and birth photographer, joining us today to answer all of our burning questions. And this one is called, What's a Doula and Do I Really Need One? Welcome, Carson.
Thank you so much. I'm so happy to be here. And I want to first start by just apologizing if my brain is a little slow. I actually just got home from an all-night birth, so I haven't slept since 2 days ago, but it was so beautiful, and I just feel so lucky that I got to start my day watching a new life come into this world, and then now I get to make it. I was so nervous about missing this today and be here to talk to you guys and listen to all these amazing just panelists and speakers with so much wisdom. So thank you so much for having me. I guess I'll start with just sharing how I came to be a doula and where my passion was born. I always say that when people say like, how did this come to be in your life? And, there's a few things, but really, I think it started in my mother's birth or giving birth to me. I grew up listening to my birth story, and she always spoke of it so fondly, like it was the best day in the world, but there was a lot of fear, a lot of feeling like she had no control. And she always expressed that there was no one there to honor her needs, right? She was surrounded by so much, perhaps too much family, so much love, and so much support in the way that I think they thought they were giving support. But really, everybody in that room came in with their own emotions as a family member. Um, and no one was really there to give completely just non-judgmental, unbiased support for my mother, to listen to what she needed as the birthing person in the room, as the one bringing me into the world. She didn't know her options. She didn't know her choices. And it was a scary birth. And so that was really like, I think I grew up with a lot of fear around birth. And I think so much of us were raised to be afraid of birth, and not necessarily by our parents, but by our culture, right? You turn on any Hollywood film and it's like the most terrifying depiction of childbirth, where legs are flailing in the air and there's blood and just this masked man standing over you. And I think we live in a culture where we don't really, it's very taboo to talk about birth before you are pregnant or have given birth. And it's the best kept secret. Um, it was actually not until I saw The Business of Being Born when I was in college that for the first time I saw real, non-scripted, live footage of birth. I was so taken aback. I cried for days. I was so emotional. I couldn't believe how beautiful the just watching women in their full power, in some in ecstasy, orgasmic births, some in a great amount of pain, but working with it and feeling empowered by it. And then others who are empowered by choices to, have an epidural and all the different things that are options to mothers. And so I saw this documentary and I was like, when I was in my early 20s, and I was like, when was I going to learn this if I didn't come across this documentary? Like, we have sex ed in high school, right? They tell us how not to get pregnant and kind of scare us into that, but there's no curriculum later on that reenfranchises us in the power of this process. And as Nanny Connie said, right, there used to be this village that was there, and I think we used to be a lot more connected to our mothers and sisters and friends in this process, and now we're not. So a lot of us go through life not being a part of this process or seeing what is possible or knowing how to not only advocate for ourselves, but support one another. So that documentary just opened my heart wide open, and I was so blown away and in extra awe of every mom I saw walking down the street, every mom in my life. But I also cried because I was deeply, deeply disturbed and upset to learn about our very complex history of childbirth in the United States, and the disservice that our medical system and corporations and insurance companies and policies had done, and also racism had done to women in this country. And so that really like sparked the advocate in me, where I was like, why is this happening, right? Why do we have some of the greatest medical advancements and technology in the world, but yet we're one of the highest infant mortality and maternal mortality rates of any developed country? And if you're a Black woman in this country, these risks are 4 times higher, right? So it's safe to say we have a problem. We've had a problem for some time. My grandmother was put under and shackled to a bed, likely in her birth, right? And although that's not what's happening now, we're still facing a lot of need for change. And I really believe that the way to make change is to know what is possible and to know your choices and to really know your rights in any setting, whether that's home or hospital. So what I do as a doula is I help support parents through pregnancy, birth, and postpartum. And so a big part of what I do is education. So we're talking about, as Nanny Connie said too, like how to prepare, right? Because I think the best way we can go into a healthy birth experience is knowing your options, knowing the risks and benefits, knowing what to expect, knowing what's going on in your body, and feeling really safe. At the birth, I support all different births, from home birth to hospital birth, unmedicated hospital birth, to I know I want an epidural hospital birth, to planned cesareans. And that's what doulas are. We're non-judgmental care. We are there to support parents through this journey and meet their unique needs, right? There's no two births are ever the same. And no two people or babies are ever the same. Couples are never the same, right? And so each doula comes to the birth, leaving ideally their own expectations and thoughts and ideas around all of this at home, and being a mirror, a sounding board for parents to find their best way, and then help to advocate or help them be their best advocates in a hospital setting mostly. And that's one of the main ways that I support parents. I'm also there providing massage. So last night I was doing a lot of double hip squeezes and massage and breath work and meditation. I'm, getting water and recommending different changes in position, but really making sure that my clients' needs are being met and voices are being heard. Some of the, I think what's really cool about doulas is not only, is it just nice to have somebody there to support you in this way and really to support your partner as well, but we're evidence-based. So there's a lot of great research that actually shows having a doula isn't just like a feel-good thing. It really does equate to better birth outcomes. So I'll kind of list off a couple. There's a 25% decrease in the risk of cesarean with doula support, 8% decrease in the likelihood or increase in the likelihood of spontaneous vaginal birth, 10% decrease in the use of any medications for pain relief, shorter labors by 41 minutes on average, 38% decrease in a baby's risk of a low 5-minute APGAR score, and 31% decrease in the risk of being dissatisfied with the birth experience. And that's, they're all very important, but to me, something that I really value is parents walking away having a pleasant birth experience, valuing their experience, and feeling empowered to step forth on the journey of parenthood, which, as Nanny Connie again had said, it very, perfectly said, that it's just, it is a journey, and it does not, it only begins at the birth. And if you can walk in with your best foot forward to that journey with confidence, then it's going to make what can be a very difficult experience a lot easier. So a little bit more proof of why I think you need a doula, I am biased though, is because I don't know if any of you here are familiar with the term or the word oxytocin, which you guys can, I'm used to doing these in interactive, so feel free to join in on the chat if you guys know what oxytocin is. But oxytocin is a love hormone. It is a hormone we create in our body. It's what's released when we are with family, with friends, with loved ones, when we are laughing, when we're feeling safe, when we are having sex. It is the feel-good hormone. The highest amount of oxytocin one can ever have in their body is during childbirth, the mother during childbirth. This is really, really important because when we talk about a doula, again, like feeling good, feeling safe, feeling protected, having somebody hold space for you and your partner to be in that deeply romantic, sensual, and loving space. I often say like an experience of where you would want to have sex, right? Birth should be like sex. It should be romantic. It should feel good to a certain extent. You should feel safe, right? You should feel supported and heard and all of those things. So when we look at this oxytocin connection and all the other times we see it, it is such an important hormone in birth, right? It is so important. It's what creates the contractions. It's what makes your breast milk come out. It's what contracts the uterus after birth to stop the bleeding. So we know that when a mother's oxytocin levels are rising and healthy in labor, that her labor is going to progress, right? When we see fear, the things that can stop oxytocin are what we call the tigers, something that scares you, something that shuts you down. And it's very common to walk into a new setting with new faces and be shut down. And so having a doula, I always say, we bring the home, the oxytocin to the hospital, or better yet, we hold space and help the feeling of safety, so that parents can be in their love bubble, in their oxytocin bubble, and support that labor hormone. So I always say I'm like the keeper of the oxytocin. Anyway, thank you guys so much, and happy to answer any questions.
You know, I think, Kristen, there's so many questions. I think one of the biggest questions that comes up first is there a difference between a doula and a midwife?
Such a great question. Yes, huge difference. So doulas are non-medical. So when the baby is being born, I usually labor with my clients at home through, just us until they go to the hospital or until the midwife joins. But a midwife is very different than an OB, but they're both the professionals in the space who are looking over for the mom and baby's health and safety, right? Of course, I'm keeping an eye out for that too, but I don't do vaginal exams. I'm not taking any heart tones. I don't do blood tests. I don't read ultrasounds, anything like that. So my care is non-medical. When the baby is born, I'm either in the hospital with an OB or a midwife who works in the hospital, or at home with a midwife who is catching the baby or overseeing and just, taking the listening to baby's heart rate and taking mom's blood pressure and all of that throughout the birth.
You know, I had a doula with my first son 10 years ago, and I have to say, we actually maxed out our birth plan. We went through every option that was on there, but it was so nice to have a doula who helped us navigate that as we went. Like, it was nice. I felt like our doula, she supported both my husband and I to make the best decision we could in the moments of urgency. So that was really cool too. And then I was also going to say another cool thing was that she knew I wanted to breastfeed. So even though I had an emergency C-section at the end, she was just like, sorry, we got to like plop the baby on and feed the baby. So I guess she was just there like advocating for us the entire time. Is that a normal experience that people have?
Is it a normal, you mean
just kind of like advocating for you, like every step of the way, and just kind of being there for you and explaining things that, in the moment seem very medical.
Absolutely. And I think what you said is so important, right? Like, we can't plan birth, right? That's why I call the birth plan the birth intentions, right? It's being flexible, right? And knowing that there is a certain amount of surrender that has to take place is so important. But having, like you said, that like in those intentions, knowing all the options, knowing what they look like, and going there, talking through how could you have your best cesarean, right? What are the things in that situation that can make you feel supported? What do you need from everybody else around you? And so it's not about, controlling the birth or planning the birth or having it be a certain way, but feeling like you are being supported throughout. And advocacy is a huge part of that.
I love that. Is there a birthing position that helps a lot of women ease through pain?
Yeah. Every mom I've ever seen in labor likes to lean over, like whether it be on all fours or lean over a ball. So I always say the best way to support a woman in labor is to not disturb her, right? So I usually watch and I'm like, what do they want to do intuitively? And how can I support them getting in that comfortable position? Because everyone is so different. But I do think being on all fours is a great position to labor in, or leaning over something, swaying, standing, using gravity. But then also being in the shower or bath. Those aren't positions, but those are really great pain relief options. I call them the aquadural.
Oh, I love that. In your opinion, are water births hygienic?
Yeah, absolutely. Yeah.
All right. And if someone's high risk, can they have a doula?
Oh yeah, I think even more of a reason to have a doula. In a high risk pregnancy, there'll probably be a lot of just a lot more to navigate in a hospital situation.
Yeah, I was going to say, I think one of the biggest questions that, like I ran across when I was high risk when I had my first son. And so I was looking for someone to help us navigate the system as we went through it and like all the different nuances that we had as we gave birth to him. But I had a referral from a girlfriend. How does one normally go about finding a doula that's a good fit?
Yeah, I love that question. One thing I want to add to the last one is, I think for high risk birth, it's so important to bring in a feeling of like home for all birth, but to like help to not make birth feel so clinical in that situation. And so something I do is I bring Christmas lights and light up candles, and we have diffusers and music, and I make it a spa. And so that's another way I think a doula can be really helpful, is to like bring those good oxytocin vibes in what could be a more stressful environment. Yeah. And then to answer your question about how to find a doula or what questions to ask, is I think, asking friends, local, doctors, midwives, acupuncturists, yoga instructors, asking around people in your community. There's some great, like Akin, I believe it's called, is a registry online that you can find, and more of those are popping up. But I think more important than any question is vibing with that person. I always say there's a doula for everyone. So to be a doula, there's training and there is certification. But like I said, we don't do anything medical, right? So we don't need to be certified. Experience can matter to some, but to others, not much, right? We're not doing anything medical. So much of this work is intuitive. And so finding somebody that you trust, you feel connected with, and you feel has similar perspective on birth, I think is also important.
How important is it to interview a doula with your partner and yourself?
I think it's really important. Sometimes, I'll just interview with a mom and she's like, great, let's do it. My partner will love you. But I always say I'm sometimes more the doula for the partner than the mom. I think for partners, right? It's like seeing the person you love the most be in perhaps a great deal of discomfort or just going through such a massive transition. I think the best way to support the mother is to have her partner standing steady in his beat, feeling grounded, and prepared to go through this journey together. And so what I like to do is provide that education, but also be somebody in the back of the room that's like, you guys are doing great. Keep on doing. Yes, that's normal, for him to turn to.
Do you have any advice for partners as they go through the birth process, whether that's at home or in a hospital setting?
Yeah, I think learning, being involved in those doula meetings, reading books, really learning those options, because I always say at the end of the day, I don't speak on behalf of my clients, right? I'm helping them to advocate for themselves, and it does often fall on the partner to really be that person that's asking the questions and that's advocating in a big way. But also, I think the more work they do to unravel any fear that they have in the birth process, the more they'll be able to show up for their partner, because when mamas feel everything.
That's so true. I mean, I remember when I was looking for a doula, I didn't really know, is there a price range for different types of doulas or for types of different services? Because I remember with my son, we did because I was high risk and I was on bed rest, she did all of our birthing classes at home, which was really nice. So that was like included in her price, which was so cool. And then after the birth, she also came and did some lactation consultant services for us. So she was really full service. But is there a range of services that doulas provide? And then is there a price range that kind of goes along with that?
Yes, so every doula's practice is a little bit differently. How I work is I offer 3 prenatal visits before the birth, but I also have a 12-week virtual circle for moms to be. And so all my clients take that too. So we end up meeting weekly. And it's so fun. It's a way of doing that work, but in community. I do postpartum follow-up visits, and I'm really available throughout pregnancy. I'm doing childbirth education, preparing those birth intentions, and helping with breastfeeding support before pregnancy and after birth. So everybody has, some are masseuses, some are yoga teachers as well, and have different offerings. I do birth photography, so that's something that's included in mine, but a lot of doulas don't do. And price ranges really vary. There's no one price. I think in Los Angeles, it's probably a little bit more expensive than the rest of the country. But I think like $2,000 is in Los Angeles a pretty kind of average price. And then there's amazing foundations called like Joy of Birthing Foundation out here, where you can work with a doula at a low cost or for free. And so there's some amazing ways. Unfortunately, doulas are not covered by insurance always. So, if a doula is something that's important to you, but might be out of your budget, there are so many ways to work with doulas and organizations that make doulas more accessible.
And like kind of an interesting question. I know some people have like night doulas as they transition, kind of away from birth and like into having the baby in the home. At what point does it switch over from being like a birthing doula to a night doula, or, can they be the same person?
Yeah. So there's birth doulas and postpartum doulas. And then like night nurses or doulas that stay through the night. It can absolutely be the same person. I don't do them the same for my clients because, as you can tell, I'm sleepy and I can't imagine going from the birth to then doing the postpartum. And I think there's just people who do postpartum better than I do. I'm really passionate about birth, and that's where I feel like my strength is. But yes, there's a lot of doulas who are amazing and do both.
Very good. Is there like anything that you recommend, as a doula that new moms kind of bring with them as they go to the hospital? Be like, these are like the essentials, or do you take care of that?
Of what to bring? Yeah. So there's obviously the stuff for parents to bring of their own. One thing I always recommend is bring your own birthing gown. Like, you don't have to wear a hospital gown. This isn't an illness. This is not like a medical emergency. You're not sick. Every other floor of the hospital is not normally a celebration of life. Like, you're on the floor where it's a party day. So where, I feel like the hospital gown can be symbolic sometimes of being a patient in the hospital. So I was like, you don't have to wear that. Bring whatever you want, or wear nothing, right? That's like a tip I have. I bring candles, essential oils. I bring some snacks, honey sticks. I bring a hot water pack, which feels really nice on the lower back or belly during contractions. I bring a birth ball, and I bring a peanut ball, which is a peanut shaped ball that can go between the legs. It's great for an epidural. What else? I have a whole bunch of junk in my birth bag, but those are
those bag of tricks. I like it.
Yeah.
What are your favorite postpartum products that you think every new mom needs?
Yeah. I love this question. And I think I always tell my clients, I'm like, your baby registry, yes, the HACA, great. There's a few things you need. Yeah, you need the diaper, you need this. Your baby registry should be mom self-care and support. There's only so many bibs and onesies one needs, right? And there's like, I don't know. Yes, some of these gadgets are helpful, but at the end of the day, a rested, well cared for, nourished, healthy mom is the greatest gift to that baby, and to the mother. And so that's anything from a postpartum doula, a birth doula, massage, pelvic floor support, food, right? Like meal train or any type of in-home cooking or anything like that. That's really where I believe we should, as a culture, shift and focus more on.
I love that. Thank you so much, Carson. That was so fascinating. You can find her on Instagram at CCE Meyer for an inside look at what it's like to be a doula. So give her a follow. Thank you so much, Carson. That was amazing. All right. We've saved the best for last. Baby Nutrition 101, what you really need to know about feeding your baby. So let's get right to it. The number one question moms always have is, and even second and third time, and I can tell you that as a second time mom, I'm like, this is one of the most pressing questions there is. So once you have your baby, Our lives revolve around feeding. Is my baby getting enough? How do I know they're growing? What's the best way to feed them? Dr. Steph Lee is a general pediatrician in Pennsylvania and specializes in preventive medicine. She is also a spokesperson for the American Academy of Pediatrics and is here to talk to us about baby nutrition and feeding. All right, I know this is going to be a hot topic, so take it away, Dr. Lee.
Awesome. Thank you so much for the introduction. Super excited. We always get, now we've talked a lot about how to take care of yourself, how to prepare, and then, the birth process. And then now you're at the moment, now you have a baby in your hands, right? What do we do next? I do have slides, so I'll share this here. All right. And so like mentioned, as Mina mentioned, I am a pediatrician in Pennsylvania. Let's go see here. All right. So first of all, the most common question really is, how do I know they're actually hungry, right? And because the three things that a baby does in the beginning really is just poop, cry, sleep, pee, right? So one of the things really you have to watch out for are listed here, rooting signs. When they're moving their jaw or mouth, they're looking for the breast if you're breastfeeding. Or even if you're not breastfeeding, they'll still move their mouths that way, licking their lips, sticking their tongue out. A lot of times, and we'll go through this in the next slide, you have to watch out for these signs before they cry, because a lot of times the crying part means they're already hungry and they've already started feeling it's a later sign, right? So it can be a little bit harder if you're trying to establish breastfeeding in the beginning. It can be harder to get them to settle down and eat. And that can be a very common problem with, in the beginning with latching. If they're already struggling, now they're super hungry, it's difficult. So it's a good thing to try and figure some of these signs first in the beginning, so you can try and feed them before they get to that late stage. Sometimes fussiness, sucking on everything around. A lot of times, it may be in the beginning, they're trying to communicate, right? And so I always say, you can check first their diapers, make sure, do they need to be changed, right? Are they just looking for comfort? And a lot of times, of course, the hunger signs, then you can feed and see if that calms them down as well. One of the things I always tell my parents who are in my clinic is to check out healthychildren.org. So that's the parenting website for the American Academy of Pediatrics. So most of those are all written by pediatricians or they're approved by the Pediatric National Society. So there's a lot of good information and really broken down to help on different feeding, but also, for toddler and teens as well. So not just for infants. Another common question is how much do they actually need, right? So you're trying to pay attention to these hunger signs, but you're trying to also predict beforehand, before they're starting to get really hungry and crying, right? And getting upset. So in general, for most newborns, you're feeding about every 2 to 3 hours, or 8 to 12 times every 24 hours. So I kind of broke it down between different weeks and really up to the 2-week mark, because after that, you should be pretty well established, and it's about the same until about a month or so. In the first 1 to 2 days, babies may be feeding every 1 to 2 hours if you're breastfeeding. If you're bottle feeding, 1/2 to 1 ounce per feed. That would be the same if you were, say, pumping or doing formula. Then the first week of life, so after day 3 and on, they may still be feeding 1 to 2 hours, but they may be spending more time at the breast, 10 to 15 minutes on each side, or may increase if you're again using bottles, about 1 to 2 ounces. On the second week, they may increase to about 2 to 3 hours, or 2 to 3 ounces per feed. And this is when they should have caught up to their birth weight. So generally for pediatricians, we do see babies a few days after you get the moms leave the hospital. And then usually at about the 1 week to 2 week mark, kind of depending on if you had to have a longer stay in the hospital or not. And that's because by the second week, they should be back up to birth weight. I think the lactation consultant had mentioned earlier, you do lose about 10% of birth weight as a baby. And that's usually because there's a lot of extra fluid that they were taking in when they weren't trying to actually feed through their mouth. So there's an expected loss, but it's important to see your pediatrician in that first week to 2 weeks, because the amount of loss, if it's too fast, then that can definitely be a problem. They want to keep up with that. That may be a time if you were breastfeeding, for instance, and for some reason your supply is not coming in, or its latch is difficult and you need to supplement, then that would be something to talk about with the pediatrician. And they would track that with weight. And we do recommend breastfeeding, if possible, for the first 6 months. I know this question had come up earlier as well. We have a lot of overlap with lactation, so it's one of our people that we talk to a lot, especially as pediatricians. The mom can take vitamin D, or the baby can take vitamin D. And a lot of times your insurance will cover that, or at least be able to, if you have like a FSA or HSA, a savings account, they can reimburse you for that. So definitely always ask your pediatrician if you are breastfeeding and if they can prescribe the vitamin D for the baby, and that's totally fine. One of the things too, I always get, should I wake the baby up to eat in the middle of the night, right? If you take a look back at the hours we were talking about, it's every, 1 to 2 to 2 to 3 hours in the first 2 weeks. And it is important I always say if they're sleeping past the 3-hour mark, you should be waking them up, at least in the first 2 weeks, once you get up past your birth weight. Because in the beginning, if depending on if you're breastfeeding or formula feeding, or if they're having trouble latching, et cetera, then they may be not waking up enough, and that can be a concerning sign. So in the beginning, you definitely want to make sure that they're feeding at least every 2 to 3 hours, especially in the first 2 weeks. Some of these things on the right I mentioned here. So we didn't touch on this too much, but if you for some reason have a baby who's preterm, so that's before 37 weeks, they do track their weight gain a little bit differently than if you're preterm and lower birth weight than normal. They do track their weight a little bit differently, but in general, if you have a preterm baby who is heavier weight, or a term baby who from anywhere from 0 to 3 months, you should be gaining about 25 to 30 grams a day. And I know we go by metric here, but it's because there's about 28 grams in an ounce. And so it's hard to use ounces, especially in the medical world for this, because you want to be very specific about how much they're gaining, especially in the first 2 weeks to 3 months. So they usually track that at the pediatrician's office, of course, but it can be a good idea if you think, okay, on a ballpark, if they're gaining about an ounce a day, then you should be generally okay, because I know a lot of parents, they get worried in the beginning too. So you want to you can of course try to get a baby scale and track it yourself if you like, but still in the first 2 weeks, it's harder to do because you're trying to be very specific with how much they're gaining. Sometimes, like we said, you do need formula, and that's completely okay, right? We, giving birth to another human being, there's every expectation can definitely go out the window, right? Like we said, it's birth intention, instead of birth plans, and birth intentions, and also the feeding, right? It's feeding intentions, right? You try to do as best as you can with breastfeeding, but sometimes that's not for everybody. And so there's a lot of different products out there. I've highlighted some just to kind of give you some categories to try and understand, if you have to go down this route, what you may need to talk to your pediatrician about. So sometimes, we talked about already, if you need formula for supplementation because your baby's still trying to learn how to breastfeed, or having trouble latching or having trouble gaining weight initially, then they may need to use any one of the, there's a lot of different products that can be done for that. The specific ones that can be very confusing is if you're trying to use formula for different reasons. For instance, if your baby has a lot of fussiness, gas, or colic, right? You can do lactose-free or sometimes broken down lactose, because some people think that it may be a problem with the digesting lactose in the beginning with some formulas. So there are certain different products and that you can, usually that's like the soothe or gentle or sensitive. Those are some kind of terms that people use on their formulas. Also, sometimes you can use soy-based as well. So soy-based formulas, especially if, a parent is vegan or they're trying to decide they don't want to use animal products, there are a lot of soy-based formulas that can be helpful that you can go to as well if breastfeeding is then not an option. Sometimes a very common problem is, spit up and reflux. I always say every baby will spit up and that's why all the bibs are out there, right? But it's to what degree does it really bother them in their throat, right? To what degree is it affecting their weight gain? And sometimes if that is a problem, then you may need to switch to a rice starch or oat cereal mix into breast milk or formula. There are certain products that already have the rice starch mixed in. And so that can be helpful if that's something that parents want to do instead of trying to mix in the oat cereals and rice cereals themselves, which you can also do with regular formula or breast milk. Sometimes if you're really having trouble, there's with weight gain or with constipation, then you can switch to formulas that are hydrolyzed proteins, both partially or extensively hydrolyzed. And these definitely are, in discussion with your pediatrician because they can be used for different reasons. One of the most common might be milk protein intolerance. So usually that means for some reason, a baby is just not digesting the milk protein either in breast milk or in formula correctly, and they're really having trouble with their digestive system and having issues with gasiness sometimes, constipation, as I mentioned. So two commonly partially hydrolyzed protein products are Nutramigen and Alimentum. That can definitely help. And that doesn't always mean you have to be on them forever because they're certainly more expensive as well. But it can be for a certain period of time to kind of wait to calm down that inflammation in the stomach. And then you can discuss whether you want to switch back to another formula after a few months. The other thing too is with milk protein intolerance, that doesn't mean that, they're forever having an allergy to milk, right? A lot of times after 12 months, when you can introduce cow's milk, they can always try that at that time. Then the last one is the extensively hydrolyzed protein formulas. So those are where they're completely broken down. You can see it says amino acid based powders. And so this is for, if you're really having severe losing weight and need the last option where there's really no proteins that are together, they're all amino acid based and broken down already. So the idea is that it's maybe easier to digest. All right, and since I was, looking at the chat earlier, I saw a question about storage and breast milk as well. I just thought to add it in here. This is from the CDC. You can Google CDC storage breast milk, and this will come up, or the link there. But it's definitely something I think that is important because a lot of times, you want to know that it's lasting enough. So up to 4 hours for freshly expressed or pumped breast milk can be on the room temperature. And then refrigerator can be up to 4 days, and then freezers for sure, it can last up to 6 months or more. And then definitely you can use leftover from a feeding up until about 2 hours or so, as you can see at the bottom. Sometimes, babies, they're cluster feeding or which they can do still on the bottle, or they're not, finishing the full feed, however much, if you pumped however many ounces you have, you can always use that leftover again within a few hours or so. All right, so that's all that I've got here. I'm sure there's maybe some more questions or anything. Happy to take any.
Well, there are so many questions that I know people have. I mean, one of them is, how do you know that your child is having a protein or milk allergy to the formula that you're giving them?
Yeah, so sometimes that allergy, it can be difficult to diagnose. There are certain symptoms such as constipation, increased fussiness, Sometimes blood in the diaper, that's the most telltale sign. And that's because there's a lot of inflammation that's happening in the gut. And so because of that, they think that it can cause some blood to leak out from the tissue in the gut. And it's definitely an important thing to talk to your pediatrician about, because there's also, fussiness just from gas, right? So generally it's, you try to do some, gas drops, things like that first, what we call reflux precautions. And then if those don't work, then it's definitely time to switch and try a different type of formula.
Cool. I mean, I know one of the questions that I have is, when I had my son, he was 7.5 pounds. At his 2-month appointment, he was 13 pounds. So he went way up on the chart. And then after that, he became more mobile earlier. And so he slipped way down the chart. And so it's been this really stressful time for me to kind of figure out, I know every baby has their own trajectory, but they're all supposed to keep moving up the trajectory. What happens if they go up and down like that? And when should I become worried?
Yeah, so that's definitely a good question, because we as pediatricians, we always track their weight on the growth percentiles, which are both CDC and WHO, the World Health Organization, projected growth percentiles for every baby at from 0 to 2 years and then 2 years and on. So usually if they're within 1 or 2 percentiles, you're still, dropping either up or low. It's usually okay. We think, maybe there's some measurement error. Maybe it's just, depending on how old they are, they're being a little picky. If they're eating solid foods already or whatnot, or if you changed a formula, you expect maybe a little bit of adjustment. If it's less than 2, if it's changed 2 percentiles or more, then there's definitely a deeper evaluation that needs to be done, because, is it they're not digesting it enough? Sometimes you do find that with milk protein allergy, that they may not be absorbing all the nutrition enough because there's so much inflammation. It's just kind of coming out, right? So that would be where it starts to be a little bit more concerning.
Got it. I think people always want to know, is it okay to put baby cereal into my baby's bottle so that they'll sleep longer at night? And does that really work?
Yeah. Well, we definitely get this question a lot, especially sometimes grandparents, I think, because this is an older generational idea that would help soothe, crying and sleep, right? It does work, but also because you're basically making them feel fuller, but you're also adding calories. So we do say not to add rice cereal or any sort of cereal unless they're having issues with reflux, because that is a solution, as I mentioned, with reflux or excessive spit up. But I would let your pediatrician know and chat about that, because a lot of times, again, you don't want to give too much weight gain, because you can, obviously lead to more problems and increased risk of obesity for future in life if they start out having too much weight gain.
Okay, cool. And then when can we start solids? Is that something that, I remember rule of thumb was 6 months, but can we start sooner? Can we go later?
Yeah. So the American Academy of Pediatrics does recommend 6 months as a general rule, because that's when babies start sitting up more. They have a lot more neck control. They can usually sit up without too much support, maybe like a little hand or something on the back. And that's to make sure that they, by that time, practically all babies will have developed swallow for solid foods, and also better neck control. So they're not gagging as much on anything else that's thicker than, breast milk or formula. Sometimes with some, when I see parents, usually we see them at 2, 4, and 6 months. Sometimes at the 4-month mark, if I feel like their development is going amazingly, they're much farther developed in their gross motor control than the typical baby, then I may say, okay, maybe at about 5 months, you can start doing some tastes, just a couple like teaspoons or something, just so they get used to the textures. And then you start, real solid foods around 6 months. But there's some flexibility, but in general, mostly it's 6 months, because it's hard to predict, right?
No, it is. And I was also wondering, a lot of people, with my first son, I started with purees, and with my second, I did the baby-led weaning. Is there one that's better than the other? And how do you know which one's right for your baby?
Yeah, baby-led weaning has really become a big thing, I think, in the recent years. And I mean, I'm all for it. I think it's the only thing that parents need to be aware of is, you're essentially still doing the same thing. You're offering them foods that are developmentally appropriate, which at 6 months is still pureed soft type foods, right? It may just not be the jar food. It may be mashed potatoes or, sweet potatoes that you've mashed and that kind of thing. Or like porridge, cereals, that kind of thing. So either is totally fine. I think it's up to, the parents to decide, which direction they want to go. Sometimes baby-led weaning, I think, can be a little bit more messy because you're allowing the child to feel and touch and try to put things in their own mouths. And so developmentally, that, in the beginning, they can be a little bit messier. So if parents are ready for that, then they can certainly do that.
One of the questions that just came up is, what are some of the best, I would say, first foods to try?
Mm-hmm. Yeah. That there used to be some idea, that it should be fruits versus vegetables versus meats and that kind of thing, right? But I think really, I would say like oatmeals, yogurts are good, especially if you're getting used to moving away from getting more of that calcium and stuff in with the yogurts, and something if you're pureed jar food, fruits and vegetables, or if you're doing purees yourself, like sweet potatoes, mashed potatoes, something like that. Yeah. One thing to note, I was going to say one thing to note is that they used to say, like, for allergen type foods like peanuts, shellfish, eggs, to wait until about 1 year later. But recent research actually says that the earlier you introduce it, the better, because you can decrease the risk of getting an allergy to foods later. So generally I say first try, fruits, vegetables, meats, that kind of thing, the first, month or so. And then after that, after they've gotten used to that, you can start trying to introduce these allergen type foods. So instead of peanuts, of course, because that's a choking hazard, right? You would do like peanut butter or something that has peanut powder products, that kind of thing, just to expose them to that. And of course, watch very carefully. If there's any family history of allergy, then you certainly should, talk to your pediatrician first, and maybe you do need to see an allergist or something beforehand. But generally, I would do those non-allergen type foods first, and then about a month or so, you can start trying the allergen foods.
How do you know if your baby's having an allergy to the food?
Yeah, a lot of times it can be like rash or something that comes out, or some sort of like worst case, maybe some vomiting, that kind of thing. Trouble breathing, of course, anaphylaxis symptoms. You would definitely stop. Give some Benadryl and then call your pediatrician. But if you usually give like a small teaspoon or so, you shouldn't have any too severe reactions. They did find that in some studies that for allergies, for allergen type foods, if you're giving eggs or something first, right, put it straight into the mouth. Don't, have them rub it over their face and stuff, because the skin can still be very sensitive, and you may think they have an allergy because they're rubbing the eggs on their skin.
Okay.
And so it's actually better to just feed first, and then instead of having them play with it, because normally for other things, you may have them play with them first just to get a feel.
That's such good advice. One of the things that I know as a new mom that stresses me out is, if you choose to go get your child vaccinated, that is like honestly one of the most stressful times. I feel myself getting very anxious. Do you have any tips for people about, being a mom that's anxious, and then too, when your baby is crying afterwards, how to soothe them, or any best practices?
Yeah. So generally you get a hepatitis B vaccine right at birth. Sometimes moms don't even know, because at that time they try to get that in right away. And, depending on how your birth process was, you might be out of it for a little bit. But generally the hepatitis B vaccine is the first one at birth, because that's the one that is most severe if it's transmitted. So they do it right away. The next set actually isn't until 2 months. So you get them usually at 2, 4, and 6. Then you get a bit of a break. Usually at the 2 month mark, especially if it's a first time mom, it can be very difficult to see, because you don't want your child to be crying, right? But they're super important to get. So I always say, you can give Tylenol afterward if you need to, for fussiness, a little bit of fever that can be expected. You can always ice the area on their, if their thighs, if it gets a little bit red, that's okay too. And then just lots of cuddles and swaddles.
I love that. What's your number one piece of advice for new parents out there?
Yeah, I'd say, and I think this the theme throughout this event has just been, give yourself grace and be kind to yourself, because, you plan as much as you can, but at the end of the day, it can be unexpected. Things may come up and it may not be exactly what you wanted, and it may be exactly what you wanted, and that's okay either way. I think it's important to remember to be as flexible as possible, because you're adjusting to a new life, and that's super exciting and important, and also can be very stressful. So just making sure to take care of yourself too, and you and your partner both, because a lot of times we always take it on ourselves as moms that this, I went through all this and I had to do all this, right? And it affects the dads and or other moms, depending on what your family situation's like. It can affect other people too. So just making sure everybody's kind of taken care of and gotten the support that they need.
Perfect. I know one of the questions I had when I was looking to get a pediatrician, because you need one to come to the hospital after you give birth. How do you find a pediatrician? Do you interview them? Do you pre-meet them? What is the process of getting a pediatrician for your soon to be born baby?
Yeah. So a lot of times it can be, word of mouth, just asking around, your friends in the area, recommendations. And then also we do have lots of pediatric practices will have meet and greets with pregnant moms. So you can definitely always call up and ask, can I meet one of the pediatricians? Can I talk through what the process is? There is some flexibility, as I mentioned, the first week or so about when they'll want to see your baby. So kind of getting that expectation, like, do I call the next day after I get out of the hospital? Like, do I call when I'm in the hospital? What's that like? And who do I call? Right. Because they, most times if you're going to see a doctor, right, it can take, 1 to 2 weeks or even a month to get in to see your own doctor sometimes. But especially for newborns, there's always appointments open that, practices will save appointment slots. So they know, can get one in then right after the baby is born. So it's usually a good way too.
Do you have some questions you suggest people ask? If you're doing a meet and greet, what are the best questions to ask to make sure that you're both a good fit for, both your lifestyle and the practice?
Yeah, I think a good thing to ask is, what kind of support does the practice have for you, right? So a lot of times, especially with newborns, if you're first time mom or second time mom or just a mom who forgot what having a baby was like, you may have questions that come up in the middle of the night, or you may have, things that you want to ask that, if the baby has a fever or something's going on, right? So always asking, do they have an after hours call service, or what's their same day appointment system like? And then asking also, do you have a lactation consultant? A lot of private practices, pediatrician offices will have a lactation consultant on site, or sometimes they have mental health support on site. So or people that they are really well established with, that they say, oh, we always, just walk down the street and that's, where they are. So those are some good ideas, good questions to ask when you're doing your meet and greet.
And I guess for our last question, what do you find the number one question is when people come to you when they're having a baby or when they have a newborn?
Yeah, I think we touched about it a lot. Just, how do I know if they're getting enough, or how much should they be eating, right? And it's really just paying attention to those cues as much as possible. And, it's a learning process. I think in the beginning, nobody knows exactly how to be a mom in the beginning, especially to a newborn, right? And your baby's learning too. And I think it's a good idea just to remember that, and just to, when you're getting frustrated, take a deep breath, because it's a learning process for you and the baby to figure out, but the baby's cues and how they're communicating with you, and just making sure you're keeping track of that weight as much as possible.
Well, thank you so much for your time today, Dr. Lee. Make sure you give her a follow on Instagram at Steph Lee MD for more pediatrician tips. Thank you so much again for your time today. We really appreciate it.
Yes, thank you.
All right, now time for our final giveaway package: an adorable radio flyer wagon, diaper genie complete pail and nurser bottle set, $50 worth of goods from Go Silly, a Lula doll sleep aid and outfit, a $45 gift card to PediPed, a trimester treats gift box, and a Lavender Life company Xander Bunny goes to Aaron Castro, congratulations. We will reach out to you with the email you registered with today and get you all set up. So congratulations again, Aaron Castro. All right, and that brings us to the end of our very first Hello Baby event. We hope you learned a lot and we wish you the very best on your journey through motherhood. Remember, you're never alone and we're all in this together. Don't forget to check out mom.com and give us a follow at mom.com on Instagram for more awesome parenting content from pregnancy to baby and beyond. Thank you all so much for joining us today. We can't wait to talk to you again soon.